My name is Tom Fraiser. I'm here today in the capacity as a retiree and a volunteer for the National Committee to Preserve Social Security and Medicare. One thing I want to just make clear here that when Billy is basically talking about the federal issues, Medicare and Social Security, and when we ask you to take action on these kind of things, you need to do that with your federal senators and congressperson. And Noreen and Bob and I are actually talking about state issues, which you would, if these things interest you, you would have to contact your state representative or your state senator. So just wanted to make that clear to everybody. I want to talk just a minute about family care, which I think is the program this gentleman was talking about. And even though there was a cut, it sounded like it worked out okay for you. But La Crosse has family care, so I'm not going to bore you very long because you have it. But there's 15 counties in Wisconsin that do not yet have the family care program. And if you don't know what family care is, it's Wisconsin's long-term care reform program. It's what Tommy Thompson called family care when he introduced it in his 1999-2001 budget. But it basically, before family care, if you were an older person, or a person with a disability for that matter, and you needed long-term care help and you couldn't afford it, the state would likely say to you under Medicaid, well, we can help you as long as you are, one, broke, and two, you want to go into a nursing home. So that you had to do both of those things to get help under long-term care under Medicaid back before 1999. And that's just the way it was, because if you could qualify for other help, in-home, assisted living, group homes, things like that, but there was no money. So you went on a waiting list. So family care basically pooled the money together and said that people that were in family care areas, if they were eligible, they had the same access to home and community care as to nursing home care. You can still get nursing home care under family care, but you also have a right, the same right, to home and community care. So that was a big difference. So that started in 1999, or at least the proposal. It actually started in 5 counties. Crosse was one of them, right? Yes. Crosse was one of the first 5 counties in family care in 2000, I think. And then it started expanding then under Governor Jim Doyle, a Democrat. Tommy Thompson, a Republican. Governor Doyle, a Democrat. And now it's expanded to 57 counties, but there's still 15 counties that are not in family care. So older people, people with disabilities in those counties, they have a waiting list or a nursing home. That's their choice. And I call that 2 bad choices. You don't like either one of them. So we are trying to get in the state budget, again, a state issue, to get the legislature to include 8 more counties. 8 out of the 15 counties have been doing planning. They have planned for several years. They actually very much want to be included in family care. They want to start eliminating those waiting lists in their county. And so far, the governor did not include it in his budget. So far, the Joint Finance Committee has not included it. And again, you have it, so you don't have to do anything. But just like Noreen was talking about the funding for nutrition, well, La Crosse didn't have a cut, stayed about the same level. We would ask maybe that you consider helping your friends in those other 8 counties that really would like to get into the program and start doing what you're doing. So that's my appeal to you. On the back of your handout, if you got the handout, that the front says President of the United States on top, and on the back says Family Care 2013. There's some information there that says that Family Care is eliminating waiting lists. It has changed the basic way. It has flip-flopped how we provide home and community care versus nursing homes. We used to do about 70% of the money for nursing homes and 30% for community care. We now have just reversed that. We've saved millions of dollars by reducing nursing home utilization, because guess what? If you give people a choice, they choose to stay at home or group home or some other setting that on average is less costly than a nursing home. So, any questions? I'm going to stop there because, yes, ma'am.
Question about Medicaid expansion in the state of Wisconsin. I know that the governor had refused it, but there are still several people lobbying, and I know we as a county board last night put through a resolution asking for reconsideration of that. Where do you see that standing?
Well, it's pretty much standing exactly where you said it's standing. The question is about Medicaid expansion that is a part of the Affordable Care Act that would say that in order to expand health care to millions more people, the way to do it for very low-income people, under 133% of the poverty level, is to expand Medicaid. But when the Supreme Court ruled on the constitutionality of the Affordable Care Act, they said it was constitutional, but then they said states could not be forced to expand Medicaid. So Governor Walker has said, I don't want to expand Medicaid. In fact, as I understand it, his proposal would cut quite a few people off Medicaid. He would go back to 100% of the poverty level and say, well, let all those people get care through the health exchanges. And of course, a lot of us have concerns about that. Plus, it would be spending more money to serve less people, because there's millions of dollars, actually billions of dollars, that are available under the Affordable Care Act to do this. So there are a lot of groups, a whole lot of groups, and I'm glad to hear your county has done it. I'm involved with Bob Kellerman and a lot of other people on something called the Wisconsin Aging Network Advocacy Committee. We just took a position in support of expansion on that, just trying to add our voices to all the others out there, because rural hospitals, medical society, doctors, a lot of people are asking the legislature to change that plan. I don't know whether it's going to be enough, but there's a lot of people who are saying this is not good for Wisconsin and not good for covering more people under health care. Good question. Any other questions? Yes, ma'am. Yes, sir.
This is just a perception I have. This meeting was called with Kind and Schilling, so I'm going to make the assumption that most of us are Democrats in here. And as I hear us talking, I get the sensation that we're the good guys and all of you up there are the good guys, and these other people out there, namely the Republicans and so forth, they're kind of the bad guys because they don't care about